Hey, autoimmune warriors, welcome to the Stronger Than Autoimmune podcast. I am so fired up for you to be here. If you're navigating life with an autoimmune condition, you're in the right place. I am your host, Des, and I am not just a podcaster. I am right here in the trenches with you as a fellow autoimmune warrior. We're diving into real, uplifting stories and some seriously smart expert tips and simple lifestyle tweaks that can make a difference in how we feel day to day. Now I've got to give a huge shout out to my amazing listeners. You're the heartbeat of this podcast, and I'm so grateful for you tuning in. If you're loving the vibes, here is how you can keep the love flowing. Drop a rating on Spotify, share a quick review on Apple, or pass this episode along to a warrior buddy who can use a boost of hope. Here are some nations that are killing it for our community. Workers with Autoimmune Ailments Alliance. These folks are fighting the good fight for students and workers like us with autoimmune conditions. Want to get involved or learn more? Swing by WAAA.org. They'll love to have you. Leap Cure. They're all about hooking up patients with cutting-edge clinical trials and putting our voices front and center. Check them out at leapcure.com. Adapt Naturals by Chris Kresser. They offer nutrient-packed supplements based on science. Snag 20% off your first order with my code DEZ, D-E-Z, at Adapt Naturals. From my heart to yours, I'm sending you nothing but love and good vibes. Let's dive in together. Today, we're talking with Dr. Cory Rice, Chief Clinical Advisor for Biote, founder of Modern Medicine, and a physician who's refining how we approach chronic illness and autoimmune disease. Dr. Rice began in internal medicine, but his passion led him to functional and lifestyle medicine, where the focus is on prevention, root causes, and giving patients real tools to reclaim their life. In this episode, we'll explore the truth behind common autoimmune myths, why diagnosis is so challenging, and the steps you can take right now to protect and restore your health. This is a conversation that connects the dots. Your lab results will never be the same. Let's dive in. Thank you so much, Dr. Rice.
Well, you're welcome. Thanks, Desiree, for having me. I'm excited to be here.
So before we get started on the medical part, would you mind talking about how you got into being a physician and what got you started with prevention?
Yeah. Thanks for the opportunity to be here and to discuss that. And to discuss, a very passionate topic of mine, which is, busting myths and misconceptions about some of the more common diseases, certainly on the immune system or autoimmune side. So I'm excited for that today. So my journey in healthcare is not a linear one. This is similar to, I think, a lot of folks you may have on. It's somewhat jagged. My initial start, I guess, somewhat in this space was years ago. I was the first graduate in college from Baylor in Texas with a forensic science degree. So, yeah. So are you a bear?
No, I'm Texas.
Oh, okay. Texas. I was like, holy cow.
I will say y'all, so watch out.
No worries. Well, I'll say y'all as well. So I started off, ironically, teaching for the university and then getting off a little bit into the law enforcement side of forensic science. And really, forensic science is putting puzzles together, essentially putting the dead back together to help reunite someone with their loved one. And then if you're fortunate enough, help catch who or whatever caused whatever you're finding. And so forensics, it was from a anthropologic perspective. I worked on unsolved homicides and, bodies that were found, missing people. Did this for 3 years, and it was enormously rewarding. Yes, when you could reunite loved ones. Essentially, my job, Desiree, was to take bones in the ground and, give the dead a voice and help figure out who this was with any approximate accuracy. and then ultimately work with law enforcement to identify these people and reunite them with loved ones. So it was a rewarding profession. However, it was also a quite morbid one. I was exposed to elements of life that I was not aware of. After 3 years of doing that, I had a sort of inflection point. I had a choice. I was accepted into the FBI, turned that down, decided to go into healthcare. When I finished medical school, I went into internal medicine. And internal medicine is really the study of the body and all organs. And, it's sort of a overview of whole body health, traditionally speaking. Well, so I went into internal medicine, and then a couple of years after that, I decided the idea of just blaming, naming, and taming a disease with a drug was one that wasn't really working for me. And so I took a leap of faith and went off into a modality of this idea of lifestyle medicine and what is now termed functional medicine. It's really just the root of the cause. What is the reason you have cancer? What is the reason you have autoimmune diseases? There's not a singular cause to these things, but if you can start to do, well, a forensic analysis on a human, you really can put people back together. So you can restore function to dysfunction. So life is cyclical sometimes, right? And so I think I started out working on dead people and putting the pieces together to help figure out who they were. And now I have a professional calling where I'm essentially doing the same thing. It's just with a live person who can smile and laugh and cry. And I am literally on the daily enormously impressed by the resolve of the human body and what the body can do to help itself if you give it the right inputs. And that's more of an art than a science. Hopefully that gives you and your listeners a conceptual understanding of what it is I do.
Who would have thought you started with dead people? The way you explain it, it's really puzzle piece. Like you said, you're breaking that down, and that is amazing to know that you're able to put all that together forensic wise. And now you're applying that same knowledge to people that want a healthier life.
Right. It's a
Yeah.
wild, I hope it's just the beginning. Everybody's got a story. And these stories aren't accidental. I think they happen for reasons. And I think every patient that sits in front of me is meant to be there because they have a unique story. And I just love applying basically my forensic skills to a live human.
What is more challenging, working with somebody that cannot speak with you as opposed to somebody reflecting back, like, I can't do what you're telling me?
Right. So it's double-sided. In one sense, if you have a set of bones, there's an algorithm you can use on the bones to measure size. You can even look at a female remains and know pretty much with certainty how many children she had. And these are very defined parameters around assessing forensically remains. In some ways, that's nice because you just have what you have. You have articles of clothing, jewelry, and bones. There's no hunting. It's right there. But the paralyzing part to that is when you cross-reference all of that material with missing persons databases and you get a list of potential matches and those lists don't pan out. It's a burden and it's a blessing when you have that, because if you're a humanistic person with emotions, you can't live a normal life, I don't feel like, and take that home and not, because at the end of the day, Desiree, you're the voice for these people who were found. And you feel somewhat, it's tough if you can't solve it. And those are the ones that stick with you. It's not families and loved ones you match up. I mean, those were great celebrations, but quite frankly, it's the ones you can't get that kill you. And so I think, the other side to that, when you're working with a human, obviously, there's a lot more detail and a lot more information that you can be given, but it's enormously more complex because the body, the more you know, the more you don't know, right? The body isn't just genetics and how you eat. It's made up of all of these lock and key mechanisms on the DNA side that there's essentially a suite of padlocks in our body that get unlocked or unleashed if you have stressful environments, you don't sleep, you don't eat well, you don't supplement, your hormones are off, thyroid's off. When all these things happen, you start to unleash things within the body, which makes it very difficult for a doctor, especially in the time constraints of formal medicine, to get to the bottom of this. So I think in some ways it's easier to work on someone who's not living because you only have a set of inputs. You can't keep finding new things, but you have to be an interesting human to be able to compartmentalize that side of death and the darkness of that. And so the lightness of life is so much better. And I take it 1,000 times out of 1,000 times. So I'd say humans, because of the complexity of disease these days, are more challenging if they're alive than if they're dead. So, but you asked, no one's ever actually asked me that question.
Oh, thank you for answering. I really do see it. I could not take the darkness. So you talked about algorithms. How do you apply these algorithms to autoimmune disease or misconceptions with autoimmune disease?
Yeah, golly, there's a litany, I think, of myths and misconceptions as it relates to autoimmunity. In my world, keep it simple, right? It's complicated, but keep it as simple as possible because the consumers I serve, they need things simple. And simply put, an autoimmune disease or autoimmune condition is just an attack. Your body doesn't recognize you anymore, so it turns against you. Whereas before, if you get a respiratory infection, a rash, a throat, something, a virus, your body recognizes that as foreign, attacks it, and you get better in 4 to 7 days, whatever it is. An autoimmune disease, it doesn't recognize that anymore. It actually looks at you as a virus, you as a foreign invader, and then it starts to attack the tissue. And so in the world that I live in, 70 to 80% of the immune system, we know this, is at the layer of the gut. If you find that they have autoimmune disease, you really have to start at the level of the gut. Because if you can't repair that function, all bets are off. I think one of the more common misconceptions and myths is that autoimmune diseases, number one, are rare. Around 1 in 10 humans have an autoimmune disease. 75 to 80% of those humans are female. So that's one big misconception. I think the other one, which probably resonates with you and your listeners, is, you can't fix it. Once you have it, you have it. Just mitigate the symptoms so that you don't feel as bad as you are. But once you have a disease, it's sort of you're going to die with that disease. And that is just not true. You can unravel and you can fix, and we're taught not to use the 4-letter C word in healthcare, but you can cure it. You just have to catch it early enough to sort of change the trajectory of where their health's going.
So there is a point where, I guess, a point of no return. I mean, in your eyes, you can get into remission, but it's always going to kind of, if you don't catch it.
Yeah, there is a point of no return, but I would say that is so far down the spectrum of disease. I think the majority of autoimmune diseases can be positively impacted and, quite frankly, turn the course backwards so that they no longer are getting degeneration or degradation or attack on that system. But there is a point where the body, the inflammatory burden is so decompensating, you can't really put the genie back in the bottle. And so I think in healthcare, and it doesn't matter whether we're talking about this, cancer, Alzheimer's, MS, ALS, whatever. The name of the game is early detection. We only win in healthcare when we can early detect diseases. And nothing could be more true than in the autoimmune space. I screen everybody that I see, no matter their age, for an autoimmune disease. And I get this. I understand from my colleagues. I do a lot of teaching and training, and I get it. That's not the standard of care, but I think it's the standard of my care because I just want to early detect these things. And I'm not going to apologize for that. I think, so I think that's just where we are right now.
You say you screen for autoimmune. What tests do you run?
Yeah, so there's a litany of these things, and most of this is serum based right now. One common test that clinicians that listen to this may be familiar with is an ANA screen. And ANA stands for anti-nucleus antibody. So many, many, many people who would otherwise feel healthy and perform healthily have a positive ANA, and I get that. But a positive ANA is a way to know your body's autoimmune. The question is, when you get an ANA, it also gives you what's called a titer. And a titer is a number that gives you how severe is whatever it is that you have. How severe is that? And so depending on the level of the titer, sort of drives the aggressiveness of what you do on the treatment side. So number one, an ANA screen, because if it comes back positive, it's reflexively screening you for like 70, 80, 90 different diseases that can be picked up on a blood test. I like to screen people for celiac disease, gluten sensitivities. There's a fascinating condition. More and more adults are getting type 1 diabetes. These are healthy looking people that cruise through life. They hit age 40, age 45. They go to the doctor. The doctor says, your blood sugar's wrong. They screen and they say, oh my gosh, your A1C is 7.5. And they're like, are you thirsty? Are you peeing a lot? Like, are you eating a lot of sugar? And humans usually like, no. And what's happening is there's an autoimmune condition that attacks what's called the beta cells. So the beta cells live inside the pancreas and secrete insulin. That's what keeps us from being a diabetic. Well, there's an autoimmune disease out there that attacks these beta cells and basically renders them ineffective so that you can't make insulin anymore, which means you're dependent upon insulin, which is synonymous with type 1 diabetes. This is called latent onset type 1 diabetes of the adult. It's an incredible disease. So I screen everybody for that as well. Luckily, a lot of people are negative, but every now and then I'll find one. And so that's the overall screen that I do initially, outside of doing a microbiome assessment that gives me a shot of their immune system, but specifically screening for autoimmune disease.
Yeah. And does your microbiome assessment use that GMAP or GI map, or is it more comprehensive?
Yeah, so my preference actually in clinical practice is I do a 3-day stool collection. So it's essentially a 3 days of collection over the course of 7 days. And it gives me essentially all the markers I need. So are you breaking down protein, carbs, and fats? Is there a malabsorption there? Is your gallbladder and pancreas working in the context of digestion? Is there a parasite, a pathogen, overgrowth, undergrowth? Is there yeast problems? All of these things, is there inflammation? All of this stuff can be seen through a stool analysis. And so it gives me a ton of information that I otherwise wouldn't have. So I don't get a lot of pushback on it. I know that it's not fun, but it's really just between you and your bathroom. Nobody sees anything. And it really does give a clinician a wealth of information.
Yeah, that sounds way more comprehensive and taking it over 3 days instead of just once and expect all these answers.
Yeah.
And I want to be mindful. I remember seeing Biote when I would visit doctor offices. Did radiology marketing for a while. So would you mind, I know you mentioned 75 to 80% of people that have autoimmune disease are women. So in your mind, or in your opinion, since you do Biote and that has to do with hormones, do you think they're correlated as far as the reason women get more autoimmune diseases?
Yeah, so there's a direct correlation, no question, about hormonal decline and autoimmune disease risk, right? So they're all in kind of the same trajectory. So the biggest thing to understand is aging is the number one risk factor of developing essentially any medical infirmity. So aging is synonymous with the decline of hormones. As you as a female age, your hormones decline irrespective of your health status, irrespective of how you eat or exercise or what have you. If you throw onto that health issues, inflammation, let alone autoimmune disease, hormone replacement therapy and looking at hormone levels in autoimmune patients is critical to helping restore their quality of life. Hormones themselves, estrogen, testosterone, and to some degree progesterone, help create a more robust immune system. They feed the immune system. Like, let's just talk about there's a condition out there, Sjogren's. Sjogren's syndrome predominantly affects women, is a terrible situation where the mucosa throughout the body is so dry. Eyes, mouth are enormously dry to where they have to use drops and they have to use something to keep saliva from forming or keep it forming. Not only that, their joints and their skin dry up. And as you know, as a female goes through perimenopause into menopause, everything starts to dry up. And so vaginal dryness is a very, 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 very big part of Sjogren's. And vaginal dryness is like an issue because it increases the risk of UTIs and all of these things. It's enormously uncomfortable for her. And so if you can replace her hormones or optimize her hormones, there's no question it's going to help some of those conditions. But, most of these autoimmune diseases are so inflammatory in nature that if you can replace hormones safely and effectively, which is all we talk about and train about it at Biote, no question is do the autoimmune patients, their symptoms are certainly better. So I think there's a quality of life component here on the hormone replacement side that helps autoimmune disease tremendously. Hormone replacement therapy doesn't necessarily cure the autoimmune disease. That's more of a deeper dive into the gut and retraining the immune system to stop fighting you. It's more of the anti-inflammatory benefits of testosterone and the lubrication benefits of estrogen that are so palpably successful for their symptoms that I think is why if a woman's on hormones and has an autoimmune disease, she's more likely to want to do other things that you want her to do because she just feels better than just being miserable all day, every day, if that makes sense.
No, completely. I'm glad that we brought that in. Also, I was wondering, since you are the Biote guru, how I know a lot of people talk about cancer and hormones. Would you mind addressing that since there's still a stigma around taking hormones? If you
Absolutely. Yeah, be happy to. So the stigma is one that is rooted from years ago, where some conclusions made from studies that were done were at the time misinterpreted. And so when you go and reanalyze a lot of the data from those studies done way back in the day, the reanalyzation actually proves the opposite. Hormone replacement therapy certainly doesn't lead to more cancer deaths or more cancer diagnoses. It actually, in some cases, is protective against it. So if you go back to 01, 02, 2001, 2002, I mean, Time Magazine and all of these other news outlets were reporting like the dangers of hormones, breast cancer. On the male side, the idea of prostate cancer being caused by testosterone use has been completely flipped on its head. Men that get prostate cancer, women that get breast cancer, a lot of these women are naive to hormones. They don't have them in their body. It's the same with men. When their testosterone is low, that's where you get aggressive prostate cancer. But you're going to be hard pressed to find a correlation or a causation between the cancer and the actual hormones you're using. And my argument has always been this. Okay, if you develop a cancer while on hormones, those hormones are protecting you against heart disease. They're protecting your bones from fractures. They're protecting your brain from cognitive decline. And they're protecting your age, right? Your aging, the look. Women who are on hormones, through the elasticity and the collagen in their face, you can tell they're on hormones because they look younger. Hopefully very soon, as they're going to remove a lot of these black box warnings and things that have really led to a lot of misinformation, not just among consumers and patients, but my gosh, doctors. Doctors still quote these things like, oh, that's going to cause you to develop this, or that's going to cause this cancer or that. And it's just not true. It all comes down to a risk benefit analysis. What is the risk of you taking these hormones versus the benefit of you, or the risk of you not versus the benefit of you taking them? And that just comes down to talking to someone who is educated on the subject and who isn't biased.
That's wonderful that you're giving people a choice, at least an option. And thank you for explaining so much about hormones. I know we kind of moved on about from the gut. So taking care of your gut is probably the best thing you could do when you have autoimmune disease. What else would you say is an overlooked lifestyle thing that can either better autoimmune disease, help autoimmune disease, or trigger or worsen autoimmune disease?
Yeah. And thank you for asking this, because I think every one of us deals with this at any given point, honestly, of the day. The most overlooked lifestyle factor that triggers an autoimmune reaction and causes a cascading event to where you can develop multiple autoimmune diseases is unequivocally stress. The amount of times I've seen someone come in here and they're either going through a divorce, they are having a loved one is sick, heaven forbid they lost a child, something is terrible, they lost a job, like something is going on that has completely turned their life upside down. That triggers an autoimmune reaction a lot. So it is so easy and cliche to say, but my goodness, stress, adaptation, and the ability to cope with stress is so critical. And, this is a big topic of mine, but just creating resilient patterns within your life that help you not harbor the stress so much so that you can just let it hit you and move on are so important to preventing autoimmune disease. One of the biggest things you can do to ameliorate, or at least, not feel autoimmune. I'd love to say, the perfect prescription for any human being is exercise. There's no question about it. But even beyond that, when you talk about autoimmune disease, You have to eliminate the inflammatory foods. And I like to say fix the gut first because that's the right answer. But if that's just too complicated for your listeners to think, my God, I'm not going to go do a stool analysis. I'm not. I mean, that sounds yucky here. That sounds complicated. I would say it's not, and it's not, and you need to. But if they don't, that's okay. If you can limit wheat and dairy, your autoimmune disease will start to get better. So whether that's psoriasis plaques, lupus rashes, you can fix MS if you can fix the immune system, how they're eating, their hormones. I mean, whole body kind of therapeutic wellness side to this is how you fix some of these diseases. Never forget stress triggers autoimmune disease, even above food. It is stress, stress, stress.
Even raises the blood sugar. Do you find that with people that, like you said, the latent type 1 diabetes comes into your office?
Yeah, no question. With cortisol dysfunction. So cortisol is the stress hormone, right? So we have adrenal glands that live above our kidneys. And when we're stressed, it's okay. Our body can adapt to that. It withdraws cortisol from the adrenal bank. And that's okay. If you're running away from a tiger, if you're in a situation that is enormously stressful and your body's prepared to get out of it, that's great. Because that's cortisol. Cortisol's saving your life. That's what we want to happen. It's that we live in these high cortisol states because some people feel like they're running from a tiger every day they get up and go to work. They feel like they're running from a tiger when they go home and they visit their spouse. And that is awful because essentially the cortisol bank runs to zero. And if your bank account has zero in it, there's nothing left to withdraw. And if there's nothing left to withdraw, you're going to flatline. And if you flatline, what happens? You gain weight around your belly. You're tired all the time. You can't mount a stress response. You literally feel nothing. And that's not a way to live. And so to your point, your beta cells start to fatigue and you start to get a glycemic load and your blood sugar goes up because of the cortisol load. And what happens when your cortisol goes up? Well, it's like when you have that steroid go up, you eat more. And what you do is you grab carbohydrate. And when you grab carbohydrate, it creates this whole
It's a vicious cycle.
Oh, it's a blood sugar cycle. And then when you eat carbohydrate, your insulin goes up really quickly. Well, when your insulin goes up really quickly, it drives sugar into the muscle. And it just creates this whole thing. And it all can be fixed by just having resilient behaviors that keep you from not being so stressed. I mean, I'm probably making this sound simple, and honestly it is. It's just people don't talk like this, I guess. I don't know in healthcare, but this is what's happening.
Do you integrate your methods into traditional medical help as a doctor?
Yeah. We're not adversaries to anything. If you unfortunately got a diagnosis of cancer, we support you in whatever you want to do. So if you go and you do traditional chemotherapy, radiation, and surgery or whatever, all we do is complement and support your decisions for your own body. And so that's why I love what I do in my practice, because first do no harm. I mean, literally, first do no harm. Also, I think it's the emphasis on prevention and the therapies we do, from the hormone replacement to thyroid to immune system regulation. Like, all we do is try to lower inflammation. So if I was to talk to an oncologist, anyone who's traditional, who's treating you, and I'm also treating you, all I would tell them is this: all I'm doing is lowering their inflammation. And if that's a problem, there's no way a doctor would ever look at me and say that's a problem. Like, they're okay if we lower inflammation. And I explain how we do it. We just correct nutrient deficiencies. We ensure the lining of the gut is sealed. It's not leaky. We make sure their hormones are optimized. We make sure they're sleeping, they're pooping, they're drinking water. These are simple things.
How do you see precision medicine changing the future of people that have autoimmune disease or other people?
Yeah.
In your opinion?
Precision medicine is really looking at you as a whole individual, not as a diagnosis. So precision medicine is using many tools to get to the endpoint of getting you to your goals. And so I'm hopeful that nationwide, globally, there's an adoption for individualized, personalized precision care. I think precision medicine is unquestionably part of the solution because it puts who first? The patient. It puts the human first. And then you're basically, graded on the performance and the outcomes that this person sees through what you do. And so I think with the advancement of technology, both on the AI side, but on the diagnostic side, we're going to be able, Desiree, I think there's a time you could come into my office and within 5 minutes, I can give you an idea of, as I stand here in front of you, do you have active cancer? Do you have active heart disease? Hopefully, there'll be a time where I can look at you, do a single blood test, and say, you're 38 years old, but your chemistries come back and suggest you are 31. What can we do next year when you're 39 to make it that you're 28? I think we're moving towards a time where we can do these types of clock tests where we can just say, you know what are we going to do to turn the clock back? You've aged a year, but your chemistry says you've actually gone backwards 3. You've been doing this form of exercise. Oh my God, you've been doing regular sauna. That's the fun part of medicine to me, is to try to like challenge aging to see if we can help slow it down.
I think having those certain mechanisms, like you said, a checklist of to go by and how to integrate them into your life. It's a simple roadmap, but yet you have life that complicates things. And it's learning, like what you said, learning how to create that resilience within yourself. Would you mind sharing any of the tools or one tool that you give your patients or you use yourself?
Yeah. You asked, so here it comes. But so for me, number one, muscle is the currency of life. So I think people have to build muscle. They have to follow their protein goals. Must. If you lose muscle, you die. It's that simple. So muscle is the currency of life. Number two, so however you exercise, you got to. I love zone 2 training because you lower fat quickly and you can build muscle. And you don't have to go out there and run for 50 minutes or do any of that crazy stuff on your joints. So I love zone 2 training, which is super easy to do to lose fat. I eliminate the inflammatory foods. I'm a big sauna guy. So I love hot sauna, not infrared. That's probably one of the single best things a human can do in 2025 because the world is so toxic and polluted that sauna is probably for cortisol, stress, getting rid of toxins and heavy metals and battery, cadmium, all these things. Sauna is just incredible. And the evidence on what it does for Alzheimer's risk, cancer risk, dementia, it's an incredible agent. I do whole body red light as well. I stand right up on the red light. You have to get close to get the penetrance. There's a whole legion of cold plungers out there, and I get that. Every now and then I'll do some of that too, but I can't say enough about heat therapy in conjunction with exercise and obviously adequate sleep. Try to limit the alcohol. If you're going to drink, try to not do it throughout the week. Plenty of water. We do not drink near enough water. So people have to drink more water. These are simple, resilient things, and then go to a doctor who can check simple micronutrient stuff and do a microbiome assessment. And these are just simple investments that really add up to a massive return. No, I think whoever listens to this, if you're not a clinician and you're looking for someone who you want to dive deeper in some of the things I've discussed, it's about a community of healthcare providers who are trying to first do no harm, but get patients to the root of the cause of the why of their what so that they can feel better, perform better. That's why I love, again, I practice full time, but I also am blessed enough. I teach for an organization like Biote, and we represent close to 10,000 providers. We are working hard to make sure that the providers that we certify, ultimately, if they find someone who has been certified through us, and it's just biote.com, but that would be the biggest take home is finding someone. I'm trying to spread a message of hope. Whoever is dealing with these things and they're looking for someone, two things is I would look for someone potentially within Biote, and or you could look for another place I like is the Institute for Functional Medicine. The best thing is to get both of those together because both of those, I think, do a great job of training practitioners to even understand any of the things I've talked about today. So thanks for asking me that so I could give that.
Well, I appreciate your time. Want to honor your time because I know you are very busy. Thank you for coming on the podcast.
Thank you. I love doing this stuff, so I appreciate it very much.
Yeah.